Does workers' compensation cover prescriptions? When it comes to prescription pain medication, there are different factors and circumstances to consider before approving the pain medication. Take the example of a claim where the woman was previously addicted to prescription pain medication. She had a right knee arthroplasty performed resulting in extreme amounts of pain. Since she cannot take prescription pain medication, the doctor prescribed her Suboxone. This particular prescription medication is used to treat people with a history of prescription drug abuse and can also be used for pain relief. In most cases, an adjuster would not initially approve it, but in this case, it is necessary to alleviate the patient's pain. Prior authorizations. Most companies use third parties to monitor prescriptions such as pharmacy networks, pharmacy benefits manager and utilization reviews. However, the adjuster is still responsible for approving the medications if a prior authorization is required, which it almost always is. Time is also a factor with prior authorizations. Since the pharmacy cannot fill the prescription until the adjuster reviews and approves the medication, someone who had surgery 2 days ago may be suffering without pain medication. Another reason why prior authorizations are required is to ensure only the medications specifically for the workers' compensation claim are approved by the adjuster. Many times, during an office visit, doctors will prescribe pain medication for a claim along with routine medication for high blood pressure or diabetes prescription alternatives. There are times where prescription medications are not necessary. In one instance, a woman has prescribed the pain relief cream Pennsaid 2% solution that cost over $3,000. In this case, we would not approve the prescription because of the cost and the fact that there were alternative pain relief creams available. The doctor ended up prescribing her over-the-counter pain relief cream that worked. Yes, workers' compensation cover prescriptions. To know about this topic, so click and learn more. Contact with Workers' Compensation Audit. There are many rules and regulations in California workers' compensation law that relate to the delivery of medicines. Medication permission is motivated by a host of problems. The point of departure in permission is what sort of medication is being given and why. In brief, this paper will address the language of medicines in the compensation scheme for employees. Reading this can give some insight into why you are receiving your medication or why not. Yes. The California regulations specifically define the means by which drugs are supplied and recognize them. Administer implies the immediate use of a drug or equipment by injection, inhalation, ingestion or other means to the patient's body. Dispensation means that 1. The provision of a drug upon prescription by a physician or other health care provider acting within the scope of their practice, or 2. The provision of drugs directly to a patient by a physician acting within the scope of their practice. Outpatient use is a term used, if it is dispensed to be taken, applied or self-administered by the patient at home or outside a clinical setting, including, take home, drugs dispensed from a facility at the time of discharge. Home involves an institutional environment, including but not restricted to an assisted living facility, in which the injured employee lives. A prescription drug implies any medication whose labeling states, caution, federal legislation prevents non-prescription dispensation, Rx only, or comparable import phrases. Yes, workers' compensation will cover your prescriptions that are directly or indirectly related to your workplace injury. If you have been suffered a broken hand due to workplace injury, then all the medicines required to treat the broken hand will be covered by workers' compensation injury. Plus, if you have a mental health problem that was aggravated due to the injury, then the insurance is required to pay for extra medication required to treat your problem. But, many victims of workplace injury do not try to get compensated for such injuries. You have the freedom to choose the pharmacy that you buy your medicines that are covered by workers' compensation insurance. But, you have to check with the pharmacy their procedure for dealing with workers' compensation prescriptions. Insurance companies cannot influence doctors to prescribe cheaper medications. Insurance companies cannot force you to change your medications either. Once your claim becomes undisputed, the insurance company is required to reimburse all the money spent on medicines to treat your workplace injury within 45 days. But, insurance companies can deny your claim to cover the prescription. In that case, the insurance company should clarify why your claim is being denied. Workers' compensation should cover all costs related to your injury, up to and including the miles you drive for doctor's visits, so it covers prescriptions. However, all medications your doctor prescribes, and all treatments in general, need to be approved by a Utilization Review Board at your workers' compensation insurance company. Boards can be inconsistent in their rulings, and some patients see certain medications approved one month and denied another. This is why a lot of our clients at Pacific Workers' Compensation in Oakland elect to settle for a lump sum, which allows them to cover their treatment costs without having to deal with the comp insurance company and the board. One of the reasons we're the best workers' compensation attorneys in Oakland is that we have specialists on staff whose job it is to deal with workers' compensation insurance companies and doctors to try and get the clients the medically recommended care they need.